Welcome to Diagnope, where clarity meets earth. I'm Ayobami, a medical laboratory professional. If you have ever looked at your blood test results and have felt confused, you are in the right place. Today, we are diving deep into your white blood cell count, what it means, what it tells your doctor, and why it matters for your health. Don't forget to subscribe for weekly videos that simplify your lab results and medical tests. White blood cells, also known as leukocytes, they are the defenders of your immune system. They protect your body from infections, attack invaders like bacteria and viruses, and respond to inflammation and injury. We have five main types of WBCs, each with its own job. In this video, we will simply cover all five in detail, but first, let's understand what a normal WBC count looks like. Now, your white blood cell count is part of a complete blood count. So in my previous video, you can simply go to the description of this video to actually watch this. I made a video on complete blood count. Now, complete blood count, it is measured in cells per microliter of blood. Now, a normal range is typically between 4,000 to 11,000 cells per microliter, but this may vary slightly depending on the lab. Now, what happens when your WBC count is high? If your WBC count is higher than normal, it is called leukocytosis. Now, this doesn't mean you are sick, but it does mean your body is responding to something. Let us look at possible causes of a high white blood cell count. The number one is infections, especially bacteria. The second one is inflammation, like arthritis or injuries. So the third one is stress and smoking. It can temporarily raise WBCs. The fourth one is leukemia and bone marrow disorders, which can produce very high levels. The fifth one is taking some certain medications like corticosteroids. Now, the most common cause is simply infection. Your body produces more WBCs to fight it off. Now, your doctor may order additional tests to pinpoint the actual reason. A low white blood cell count is called leukopenia, and this can make you more vulnerable to infections because your immune system or your immune defenses are down. Now, let us explore common causes of leukopenia. All right. So now the most or the common causes of leukopenia. Number one is viral infections like flu or HIV. The second one is bone marrow disorders, when WBC are not being produced properly. All right. So now that is what I meant by bone marrow disorders. Now, the third one is autoimmune conditions like lupus. So I'll simply be shedding more light on lupus later. The fourth one is cancer treatment. Chemotherapy and radiation can suppress WBCs. Now, the fifth one is vitamin deficiencies, when there's especially when there's deficiency of vitamin B12 or folate. Now, depending on the cause, your doctor might suggest lifestyle changes, medications, or further testing to correct or manage it. Now, let us break down the five major types of WBCs you will often see in a CBC with differential. Now, the number one is neutrophils. So in this segment, we are trying to understand the five types of white blood cell. All right. So we are trying to understand the five types of white blood cells. So now the number one is neutrophils. Now, neutrophils, first responders to bacterial infection. They are the first responders to bacterial infections. The normal range is between 40 to 60%. Now, when they are high, the bacterial infection. When they are high, it means a bacterial infection. Now, when they are low, it means severe infection or bone marrow issue. So I'll repeat again. Now, neutrophils, they are the first responders to bacterial infections, and the normal range is between 40 to 60%. When they are high, all right, when they are high, it means bacterial infection, and when they are low, it means severe infection or bone marrow. The second one is lymphocyte. Now they fight viruses and long-term immunity. The normal range between 20 to 40%. When the lymphocyte is high, it means viral infection or leukemia. Then when they are low, it means HIV or immune suppression. Now the third one is monocyte. Digest debris and pathogens. All right, it digests debris and pathogens. Now the normal range is between 2 to 8%. Now the fourth one is eosinophils. It fights parasites and cause allergic reactions. The normal range is between 1 to 4%. When they are high, they can cause allergy, asthma, or even parasite. The fifth one, which is the last one, is basophils. Now, the basophils, they release histamine. They are involved in allergy and inflammation. All right, and the normal range is between 0.5 to 1%. Seeing which WBC type is elevated or decreased can give your doctor clues about what is going on in your body. Now, a high or low WBC count is never interpreted alone. Now, doctors always consider your symptoms, medical history, and other test results. For example, high neutrophils with a fever, likely bacterial infection. High lymphocyte, possibly viral infection. Then low WBC with fatigue and bruising could be bone marrow disorder. So I repeat this one again. Low WBC with fatigue and bruising could be bone marrow disorder. Now, so you don't have to panic when you see an abnormal result. Always consult a qualified professional to understand your report fully. White blood cells are very crucial indicators of your body's internal battles. Know what a high or low count means gives you power, not panic. Okay, this one you should worry if your WBC count is consistently abnormal, or if it is very high or very low and you feel unwell, or if your doctor recommends further investigation. So this is when you can be worried. All right. Now lab results are like clues. Now alone they can't tell the full story, but interpreted correctly, they can guide diagnosis, treatment, and peace of mind. If you found this video helpful, please subscribe to Diagnope for clear and easy to understand medical explanations every week. And of course, you can leave a comment below if you have ever been confused by a lab result. We might actually cover this in our next video. So guys, thanks for watching. I'll see you right in the next one.